Voices can occur in the general population, they can occur when we've been bereaved, they can occur when people are in certain sorts of unusual situations. For example, you can be a single-handed long-distance sailor out in the ocean and not seeing anybody at all for days on end, and then you might start to hear voices. So under all sorts of conditions, unusual conditions, like sensory deprivation, which is what that is, where you're just looking at the sea, you might hear voices. But they may be quite understandable for the person and not distressing. And then voices can occur across a wide range of physical and mental health conditions. They can be triggered by taking drugs. They can be triggered by certain drugs that you might have after an operation, so that when people are in intensive care, they sometimes hear voices. But the sorts of voices we're concerned about and we're thinking about for most treatments are the voices that occur with the sort of mental illnesses that have got diagnoses like schizophrenia, schizoaffective disorder, bipolar disorder. Those are terms for illnesses which are characterized above all by psychotic experiences, by hearing voices, by having unusual beliefs and experiences, and having changes in the person's thinking. My name is Philippa Garety. I'm Professor of Clinical Psychology working at King's College London. And my work involves understanding and finding new treatments that help people with psychosis. By psychosis, people generally mean experiences that people have which are difficult to understand and which seem different from the experiences other people are having in everyday life. So it's easier to talk about examples. Hearing voices that other people say aren't there, and yet you really feel that there's something causing the voice that you're hearing. Or having experiences which lead to beliefs that are very distressing but other people don't agree with. So maybe feeling that people are trying to harm you or following you, or that people are referring to you like in songs on the radio, things like that. And when you tell people about it, other people say, oh no, it's nothing like that's happening. So you're having experiences which other people don't confirm as true. When you hear voices where it doesn't appear that there's a physical cause for the voice present, then those are often called auditory verbal hallucinations. And we tend to call them voices because that makes more sense to people. If you hear voices and it doesn't appear that there's a physical cause of the voices, then you could consider it like a psychotic experience. But there are experiences like that which aren't distressing and experiences which are distressing. We know that maybe 15% of people report at some point in their life hearing voices, but only a quarter of those would be people who come into contact with mental health services saying they need help with them. So there are non-distressing voices, and people might say that they're spiritual phenomena. They're something to do with the way they have a special experience of the world, and they may feel that they're a positive experience, or they may hear the voice of somebody who's died that is close to them, and they may feel that's a really good way of staying in touch. But there may be other people who hear voices of somebody who's died where they feel very frightened by those experiences and disturbed by them. We can say they're all psychotic experiences, but that only a proportion of those would be experiences which we say are associated with need for care. The question of how people experience voices is that they hear something and then they can't necessarily find out where it's coming from. They may hear it as if it's clearly coming from outside of them, maybe from somewhere in the room or somewhere outside, and they may be quiet or muffled experiences, or they may be loud, clear experiences, so they may be quite different in the quality of the sound, and they may be spoken words, or they may be songs, or they may be murmuring, and then the words may be abusive and attacking or commanding or commenting on what the person's doing, or they may be quite neutral. They vary a great deal. What we find is that if they're abusive or commanding or controlling, then that's when they're most associated with people seeking help and needing help with them. Many of us say we have a sort of voice in our head which talks us through what we're doing in the day, or maybe even comments on what we're doing, and yet we recognize it as in our head and coming from ourselves. We know it's our own thoughts, maybe even voice, but we know it's ours. And what's different about the sorts of voices we're talking about is they do not seem at all as if they're generated by the person. They often feel quite different, as if they must be coming from someone else or some other entity or some evil power when they're very distressing. Sometimes not from a person, but from, maybe some supernatural being, because it's so confusing. There's nobody there. It doesn't feel like it's a thought I would have or in a voice I would have. So that's what's different about them. They don't feel internally generated. When people have distressing psychosis, which persists for some time, because sometimes psychotic experiences can be quite transient, especially sometimes if people have a bad drug trip, they may recover and not need any help after that, but to avoid those drugs. But if for some weeks people have ongoing experiences which don't seem to clear away, it's really, really important to try and get help if you're feeling distressed and finding it difficult to engage in everyday life. If the voices in your head or the fears about what people are doing to you or the changes in your thinking are causing you such distress, then you would go to see your GP and ask for help. And the treatments are either medication or talking treatments, psychological therapies, and that's what's recommended nationally. In fact, to have both very often, both some medication which may help reduce the occurrence of some of those experiences, and talking treatments which very much help to understand what's going on to you and where these experiences may be coming from and how to respond to them in a different way. If you get help early, and there's a whole network of what's called early intervention services for people with psychosis across the country, and that's a big service initiative that the NHS took in the last sort of 5 or so years ago to provide a really rich range of treatments and support for people when they first experience episodes of psychosis. And there is evidence that people do better if they're helped early, and they can access talking treatments, social support, friendship, support for their families, and medication through those early intervention teams. And there's lots of evidence that people show better recovery when they get help early. So don't hesitate if you start to hear distressing voices and that they're blighting you in some way, affecting you badly. Get help.